Okay, hi, my name is Avery Trugot. Today I'm going to be discussing the synthetic opioid crisis in the US, and I'm going to focus specifically on policy formulation. So, first, just to give you an outline, I'm going to walk through the policy problem itself, and then I'm going to go through the agenda, objectives, and policy measures, and then the solutions and alternatives to be considered. So, just for some context on the issue, synthetic opioids, and especially fentanyl, have become the leading cause of overdose deaths in the US. It's a double challenge, so it's a public health emergency and as well as a law enforcement challenge, meaning it needs responses that balance treatment, prevention, as well as harm reduction. Um, for some more context, I'm going to go through the causes, scope, and severity. Um, The opioid crisis has its roots in the overprescribing of opioid medications. This created a pathway for illicit fentanyl to dominate the drug supply. For the scope, so fentanyl and synthetic opioid crisis is a nationwide epidemic. However, the burden is not distributed evenly. Rural and underserved communities are disproportionately affected because of things like limited treatment options and just geographic barriers. Impact is very severe. So, at least 2 million people are affected by opioid use disorder as of 2017. As of 2022, the CDC reports more than 100,000 people die each year from overdose. Status quo places its emphasis on law enforcement and criminalization, which has not helped to lower overdose rates. Okay, the agenda. So the objectives for synthetic opioid policy are pretty straightforward. Reduce overdose deaths, expand access to treatment, and scale up harm reduction. Policy measures, these would include standing orders for naloxone that allow pharmacies to distribute without a prescription, federal grants for syringe services programs, and maintaining telehealth flexibilities for prescribing assisted treatment or MAT, which has been especially valuable in rural areas. There is some opposition to these harm reduction strategies. Some people claim that they enable drug use. Evidence based outcomes, though, like reduced overdose deaths and increased treatment access, are very important for countering those objections, as well as just keeping the issue framed as a public health emergency. Okay, now I'm going to move on to funding and support. So, for funding, federal appropriations via agencies like the Substance Abuse and Mental Health Services Administration and the CDC, those are the primary sources of funding currently. On top of that, though, opioid settlement funds, mostly from lawsuits against manufacturers, are increasingly being earmarked for treatment and harm reduction efforts. Um, Medicaid reimbursement and provider incentives. So these have also been expanding to make treatment more accessible, especially in those rural areas. Um, Next is public support. So this plays a very important role in sustaining all of those measures. Naloxone distribution has strong bipartisan support, while advocacy groups support harm reduction efforts more, including those syringe service programs, supervised consumption sites, etc. However, since new versions of fentanyl keep emerging, policies need to be adaptive as we go on and we discover and we learn more and more. So, solutions and alternatives. My first alternative is just to enhance those harm reduction efforts. So, this can be done with large scale naloxone distribution, decriminalizing fentanyl test strips, and creating supervised injection sites. Um, these approaches reduce immediate risks and, according to my research, are most often backed by medical associations. They're very strong proponents of the harm reduction approach. My second alternative would be expanding diversion and reentry programs, um, such as law enforcement assisted diversion or LEAD. These programs redirect people into treatment instead of jail, and research has shown that these programs reduce the odds of relapse while also improving access to care. And then my third and my last alternative is to improve medication assisted treatment access. So this would include expanding telehealth services, Medicaid reimbursement, and mobile clinics, all of which are especially valuable in rural areas. Studies show that barriers to treatment do differ by medication type. So, for example, transportation issues are associated with one type, I believe it's methadone, and affordability challenges with another. And I always forget how to pronounce this one. I believe it's buprenorphine. Um, that one's associated with affordability issues. So, this would affect especially those in those underserved communities. Um, so, targeted solutions are going to be necessary just depending on the individual's situation. And then these are my references, and thank you for watching.